Dear colleagues, today I will present to you a case of early diagnosis of horseshoe kidney. This is a congenital anomaly that consists of the fusion of the two kidneys, which are usually joined at the lower poles by an isthmus of renal tissue or fibrous tissue that crosses the midline in front of the aorta and the vertebral column. This anomaly has a prevalence of 1 in 400 births and is more common in male fetuses. As for the ultrasound diagnosis, coronal and transverse scans are essential, as they allow the demonstration of renal tissue in front of the midline. The bladder and the volume of amniotic fluid are normal. The horseshoe kidney is associated with chromosomal anomalies such as Turner syndrome in 30% of cases and trisomy 18 in 20% of cases, as well as with genetic syndromes in 15% of cases, among which the most common is caudal regression syndrome. There is an association with hydronephrosis and genital anomalies or with certain extrarenal defects, among which the most frequent are cerebral, cardiac, or skeletal anomalies. The case under examination concerns a patient at 16 weeks who comes to our clinic for a routine checkup. In obstetric ultrasound, suspicion of a horseshoe kidney may arise if there is a failure of both kidneys to ascend to the lumbar region, if the kidneys appear closer together along the midline, or if a possible transverse structure is visualized between the lower poles of the kidneys. As mentioned at the beginning of the video, this is an early diagnosis since suspicion is usually raised during the second trimester screening and, in any case, it is not always possible to visualize it on ultrasound. The patient in question had undergone first trimester screening with nuchal translucency ultrasound and NIPT, both of which were normal. The study of the remaining anatomy is normal, with both the bladder and amniotic fluid within normal limits. As for case management, a detailed ultrasound examination is necessary, along with ultrasound monitoring every 4 weeks to detect any cases of late-onset hydronephrosis. Delivery and obstetric management are not altered by the finding of a horseshoe kidney. As for the prognosis, it is favorable in isolated cases. Nevertheless, a postnatal checkup is recommended due to the risk of infection, hydronephrosis, and nephrolithiasis. And regarding isolated cases, there is no increased risk of recurrence. Thank you for your attention.